Good morning, everyone. I'm Dr. Dushyanth Kalva. I'm a plastic and cosmetic surgeon at Inform Clinics, Hyderabad. So, as a cosmetic surgeon, we do quite a lot of breast surgeries, especially breast augmentation surgeries. So, when a cosmetic surgery patient for breast augmentation approaches us, they usually tend to ask a few typical kind of questions, which are almost everyone asks. So that has prompted me to make this video today. So it is actually in the next series of videos, I'm going to discuss each FAQ, that means each frequently asked questions, as a separate topic. So the first one, doctor, when can I get a breast augmentation surgery done? So the answer to this question requires some explanation about how the breast grows and when the growth of the breast stops, etc. So let's go. So ideally, when we plan for a breast augmentation surgery, we would like the patient to be in a physiologically stable condition. That means she shouldn't ideally be undergoing a lot of bodily changes. For example, during growing phase. So especially when the patient has reached puberty and is undergoing breast development, that is the phase we absolutely do not want to operate for breast augmentation surgery. So we want to wait for the breast to stop growing, then only full after the full development is achieved, then only we want to do a breast augmentation. Similarly, we do not want to operate on a patient who is undergoing rapid changes, as in, say for example, somebody undergoes a surgery for weight loss and they are undergoing a rapid weight loss, or someone is undergoing a rapid weight gain. So these are the instances when, if we do a breast augmentation surgery, the results that we give may not hold for a very long time and they may vary ultimately. So when the physiologically, that means when the body habitus or the body weight or the body functioning of the patient is very stable, that is when we can operate on the patient and hope for a very long lasting results. So the best time to operate on a patient is ideally when the patient is not undergoing too many bodily changes. That means the patient should not be in the growing phase, for example. So we do not operate on children, we do not operate on adolescents, we do not operate on a patient when they are still growing, when the breast is also undergoing a phase of development. Similarly, we do not operate on a patient who is pregnant. So in pregnancy, as you know, there will be lots of changes, and during the phase of these changes, we do not put any breast implants, or we do not operate on the breast even for any other surgery as well. Similarly, when the patient is undergoing a rapid weight gain phase due to any reason, or the patient is undergoing a rapid weight loss phase, we ideally want to wait for the patient to stop the weight changes or to stop undergoing much bodily changes. Slight changes are okay, but heavy and large changes are ideally not a suitable time to do a breast augmentation surgery. So, if I have to put it in a nutshell and simplify it, we do not operate, or we cannot do a breast augmentation on a growing person, adolescents and growing people. We do not operate on pregnant women. We do not operate on post-bariatric patients, and we do not operate on patients for any reason who are undergoing rapid weight gain or weight loss. So such patients we try to ideally avoid and do a breast augmentation after they have stabilized. So other than this, there is no really chronological limit to when we can operate. As long as the patient is healthy and of physiologically stable, they can undergo a breast augmentation surgery. So I hope this has cleared your doubt about what is the best time to get a breast augmentation surgery done.